All right, future nurses, buckle up. Because today we're diving headfirst into one of the most crucial aspects of psychiatric mental health nursing,
Definitely crucial.
therapeutic relationships. And lucky for us, we have a roadmap.
We do.
Yeah, sort of. It's this book called, you guessed it, Therapeutic Nurse-Patient Relationships in Psychiatric Mental Health Nursing.
Ah, yes, a classic.
And it's packed with insights on how to build those vital connections with your patients.
You know those connections? That's really the foundation of everything we do in psych nursing.
Absolutely. So let's start with the basics. What exactly makes a therapeutic relationship different from, say, grabbing coffee with a friend?
Well, think about it this way.
Okay.
In a social relationship, it's all about give and take reciprocity.
Right.
But in a therapeutic relationship, the focus is entirely on the patient.
Ah, so it's all about them.
Exactly. It's about helping them understand and express their emotions, develop coping skills, and ultimately empower them on their journey towards recovery.
Okay, so we're like guides, not fixers.
Yep.
And speaking of roles,
Mhm.
this book mentions a whole bunch of hats that a psych nurse wears.
Oh, yeah.
Stranger, resource person, teacher, leader, surrogate counselor.
It's like a whole wardrobe, isn't it?
I know, I'm getting role play whiplash just thinking about it.
But each role serves a specific purpose in the therapeutic process.
I can see that.
Like the stranger role, think about it when you meet someone new for the first time.
Yeah,
You don't expect instant intimacy, right?
of course not.
You build trust gradually. And that's exactly what we do in a therapeutic relationship.
Okay, so it's all about building that foundation of trust brick by brick.
You got it.
Now, of all those roles, is there one that you think tends to trip up new nurses?
You know, the surrogate role can be a bit tricky.
Surrogate, how so?
Well, this is where things get a little deeper. A patient might unconsciously start relating to you as someone from their past.
Oh, like a parent or a sibling?
Exactly, someone who's had a significant impact on them. And navigating those dynamics takes a lot of self-awareness.
I bet. And a solid understanding of boundaries.
You said it.
It's like you're suddenly part of their personal story.
In a way, yes. And that's why it's so important to be mindful of those boundaries.
Okay, so we've talked about roles,
Mm.
but what are the core principles for building a strong therapeutic relationship?
Mm.
What are the absolute must-haves?
Well, the book lays out 5 essential conditions:
Hit me with them.
rapport, trust, respect, genuineness, and empathy.
5 pillars of a healthy relationship.
Exactly. These are your non-negotiables, the foundation of any successful therapeutic interaction.
Okay, I'm loving acronyms already. So we've got RTRGE.
Easy to remember, right?
Totally. But what did these actually look like in practice? How do you translate these concepts into real-world interactions?
Let's start with rapport. It's that feeling of connection, a shared understanding.
That click.
Exactly. Sometimes something as simple as a casual conversation about the weather or a shared interest can help break the ice.
It's about finding that common ground.
You got it. That human connection.
What about trust?
Yeah.
That seems so fragile, especially for someone struggling with their mental health.
Trust is earned through consistency and transparency. If you say you're going to do something, you do it.
Actions speak louder than words.
Exactly. You're honest in your interactions even when it's difficult. You make it clear that their well-being is your priority.
And respect. I imagine that means treating every patient with dignity, regardless of their diagnosis or behavior.
Absolutely. It's about seeing the person behind the illness. We call this unconditional positive regard.
Unconditional positive regard. I like that.
It's about accepting the patient for who they are without judgment.
Now, genuineness. Is that just about being yourself?
It's about being authentic, yes. But it's also about congruence. Your words and actions need to align.
Oh, I see what you mean.
If you're saying one thing, but your body language is screaming something else, that inconsistency can erode trust.
Makes sense.
Yeah.
Okay, and lastly, empathy. This one always trips me up a bit. What's the difference between empathy and sympathy, and why is it so important to get this right?
Empathy. This is huge. Empathy is about connecting with the patient's emotions without getting lost in them. Okay, so you're feeling with them, but not for them.
Exactly. You're acknowledging their feelings, validating them, but you're not letting them dictate your emotional state.
Got it. So sympathy is more like, I'm so sorry you're going through this. And empathy is more like, I understand this must be really difficult for you.
You nailed it. With sympathy, you risk blurring the lines between your experience and theirs.
And that can lead to all sorts of problems.
Exactly, which is why empathy is so crucial for providing objective and effective care.
Okay, so we've got these 5 foundational pillars: rapport, trust, respect, genuineness, and empathy. But how do we actually put these into practice within the context of a therapeutic relationship? Is there a roadmap or framework we can use?
That's where Peplaw's interpersonal theory comes in.
Peplaw's theory? Tell me more.
It outlines 4 distinct phases of a nurse-patient relationship.
Okay, so it's like a guidebook for navigating those interactions.
Precisely.
All right, I'm intrigued. So let's say a patient walks through that door. What happens next?
Phase 1 might surprise you. It's called the pre-interaction phase. Pre-interaction, so even before you meet the patient, there's work to be done.
Absolutely. This phase is all about preparing yourself, the nurse, for that initial encounter.
Interesting. So what does that look like?
Well, you're reviewing the patient's chart, their history, any relevant information you can gather.
Okay, so getting up to speed on their background.
Exactly. But it's also about self-reflection.
Wait, so even before you meet the patient, you're doing some soul searching?
You could say that. You're asking yourself, are there any biases I might have? Any anxieties about working with this particular patient?
So it's about acknowledging your own baggage before stepping into their world.
Exactly.
Yeah.
By addressing these up front, you're ensuring you're approaching the relationship with a clear head and an open heart.
Okay, that makes sense. The pre-interaction phase is all about inner work.
You got it.
So what happens when you actually meet the patient? What's phase 2?
That's the orientation phase, that first encounter where you're setting the stage for everything that follows.
Okay, first impressions are important.
Absolutely. You're introducing yourself, explaining your role, and starting to build that all-important trust.
So it's about laying the groundwork, establishing those ground rules.
Exactly. You're clarifying what the patient can expect from you and what you need from them to make this relationship work.
It's a two-way street.
Precisely. And it's also a time to explore their world. What brought them here, their strengths, their challenges, their goals for therapy.
I can already sense that collaborative vibe. It's a team effort from the get-go.
That's the goal.
But then things have to get real at some point, right? When do you actually start tackling the tough stuff?
That brings us to phase 3, the working phase.
Okay, so this is where the real work begins.
You got it. You've built a foundation of trust and rapport. Now it's time to dig deep to confront those challenges head on.
And I imagine this is where things can get intense.
It can be.
What kind of hurdles do you typically encounter in this phase?
Well, 2 biggies are transference and countertransference.
Ooh, transference and countertransference. Those sound like psych terms.
They are, and they can be real curveballs if you're not prepared for them.
Okay, break those down for us. What exactly are we talking about here?
Think of transference as a sort of psychological echo. The patient unconsciously starts relating to you, the nurse, as if you were someone from their past.
Interesting. So they're projecting those old emotions and patterns onto the relationship.
Precisely. It could be a parent, a partner, anyone who's had a significant impact on their life.
Wow. So you're suddenly playing the role of their critical mother or their overprotective best friend.
It can feel that way, yes. But the key is recognition. Don't take it personally.
Right. It's not about you.
Exactly. Instead, gently guide the conversation back to the present, to the therapeutic goals you're working on together.
So you're acknowledging their feelings, but you're also setting those boundaries.
Exactly. And that's where countertransference comes in.
Okay, so countertransference is the flip side of the coin.
Precisely. This is where you, the nurse, start developing feelings towards the patient based on your own experiences.
Oh, I see. So it's our own baggage coming into play.
You could say that maybe you find yourself overly invested in one patient's success.
Or frustrated with another who seems resistant to change.
Exactly. And that's why self-awareness is so vital.
So we need to be aware of our own triggers, our own blind spots.
Absolutely. If you notice those feelings cropping up, it's time to take a step back. Seek supervision. Talk it through with a colleague.
Okay, so it's about making sure our personal stuff isn't interfering with our professional judgment.
Precisely.
Okay, so we've navigated the pre-interaction, the orientation, and the working phase. What happens when it's time to say goodbye?
That brings us to the final phase, termination.
Termination, ending the therapeutic relationship.
And it's just as important as all the phases that came before it.
I can imagine.
Yeah.
But how do you make sure it's a healthy ending, both for the patient and for you?
Well, first and foremost, you want to celebrate those wins.
Okay, so it's not all doom and gloom.
Definitely not. You want to review the progress that's been made, highlight their achievements, reinforce their ability to move forward independently.
So it's a victory lap, a chance to acknowledge how far they've come.
Exactly. But it's also important to validate those feelings of loss.
Right, because ending a relationship, even a therapeutic one, can be tough.
It can be. You want to give the patient space to express any sadness or anxiety they might be experiencing.
So it's about honoring that connection while also preparing them for the next chapter.
Exactly. And ensuring continuity of care is paramount.
Continuity of care, so making sure they have a support system in place.
You got it. Whether it's connecting them with a therapist, a support group, or simply providing information about resources available to them.
So you're not abandoning them, you're equipping them to continue their journey.
Precisely.
Wow, we just whizzed through Peplaw's 4 phases.
We did.
It's a lot to take in.
Mhm.
But I have a feeling there's even more to this therapeutic relationship puzzle, right? What haven't we covered yet?
We've laid the groundwork, explored the phases, but there's one more piece that's absolutely critical: boundaries.
All right, let's talk boundaries in
As-
all ears.
Think of boundaries as the invisible lines that protect both you, the nurse, and the patient.
Okay, so they keep the relationship safe and appropriate.
Exactly. They ensure that the focus remains on the patient's well-being and prevent things from getting blurry.
Okay, I'm with you. So what do those boundaries actually look like in a psychiatric setting?
Well, let's start with self-disclosure. While it's fine to share a little about yourself to build rapport, oversharing can blur the lines.
Right, so no sharing your deepest, darkest secrets.
Probably not a good idea. Remember, it's not therapy for the therapist.
Got it.
Mm.
What about accepting gifts from patients? Is that ever okay?
It's a tricky one. While a small token of appreciation might seem harmless, accepting gifts, especially valuable ones, can compromise your professional objectivity.
So no accepting diamonds or sports cars.
Exactly. It's best to err on the side of caution.
What about dual relationships? Like if you happen to see a patient outside of the clinical setting,
Those are a big no-no.
okay, so you're there to be their nurse,
Yeah.
not their workout buddy or their family therapist.
Exactly. And finally, let's talk about touch.
Okay, this seems like a sensitive area.
It is. Well, therapeutic touch, like a reassuring hand on the shoulder, can be powerful. It should always be appropriate, consensual, and clearly within the boundaries of professional care.
And obviously any kind of romantic or sexual relationship with a patient is completely off limits.
Absolutely. Those are never acceptable and constitute a serious ethical breach.
Okay, that was a sobering but crucial reminder about the importance of boundaries.
Mhm.
Seems like we've covered a ton of ground already.
We have.
And for all you future nurses out there, remember that learning about therapeutic relationships is an ongoing journey.
It is.
It's not about memorizing a set of rules. It's about developing self-awareness, compassion, and the ability to connect with people on a human level.
Couldn't have said it better myself.
So keep learning, keep exploring, and we'll see you next time for part 2 of this deep dive into therapeutic relationships.
Looking forward to it.
All right, until then, take care and keep those boundaries strong.
Absolutely. It's like we're building a sanctuary, for their mental well-being brick by brick.
But with all this talk about professionalism and boundaries, I'm wondering, is there ever room for humor in a therapeutic relationship? Can you crack a joke or two, or is that like crossing a line?
That's a great question, and one that comes up a lot. Humor can be a powerful tool, but it's a delicate dance.
So how do you know when it's okay to lighten the mood with a bit of wit? Is there a humor handbook for psych nurses?
I wish there was. It would make things a lot easier. But the key is mindfulness.
Mindfulness. Okay.
Being mindful of the patient's individual needs and cultural background.
Right, because what one person finds funny, another might find offensive.
Exactly. And it's always best to err on the side of caution, especially in the early stages of the relationship.
So reading the room is essential.
Yeah.
No stand-up routines in the psych ward. Got it.
Probably not the best idea. But if a patient initiates humor and it feels genuine and appropriate, then it can be a way to connect.
Oh, I see. So it can be a bridge.
Exactly. A way to build rapport and even help them process difficult emotions.
Okay, so humor can be a tool, but it's not a free-for-all.
Right.
Now, shifting gears a bit, the book talks a lot about communication techniques. Any tips for those of us who are feeling a little tongue-tied at the thought of having these deep conversations with patients?
One of the simplest yet most effective techniques is active listening.
Active listening. Isn't all listening inherently active?
Well, not quite. Active listening is about being fully present in the moment, paying attention not just to the words, but also to the patient's nonverbal cues.
So it's like you're really tuning in.
Exactly. And then reflecting back what you're hearing to make sure you understand.
So it's like you're saying, I hear you, I see you, I get you.
Precisely. It shows respect and creates a sense of validation.
Okay, I can see how that would be powerful.
Yeah.
What about asking questions? Any tips on that front?
Open-ended questions are your best friend.
Okay, so instead of asking, did you sleep well last night?
Right. Instead, you might ask, how did you sleep last night?
Ah, so
Yeah.
you're inviting them to elaborate.
Exactly. You're giving them space to express themselves rather than leading them down a predetermined path.
Okay, so less detective, more guide.
Precisely.
And what about silence? Is it ever okay to just be quiet?
Absolutely. Silence can be incredibly therapeutic. It gives the patient time to gather their thoughts, to sit with their emotions.
Wow. I never thought of silence as a communication technique.
It's a powerful one, though. It shows that you're comfortable with those moments of quiet reflection.
Okay, I'll have to remember that.
Hmm.
Now let's talk about when things get tough. How do you handle a patient who's angry, withdrawn, or resistant to treatment?
First and foremost, remember that these behaviors are often a symptom of their illness.
Right, not a personal attack.
Exactly. So try to approach these situations with empathy and understanding.
So even when it feels personal, it's not about you.
Right. It's about meeting them where they are with compassion.
Okay, so validating their emotions, even if you don't agree with their behavior.
Exactly. It's about finding that balance between support and boundaries.
And speaking of boundaries, is it ever okay to set limits with a patient, even in a therapeutic setting?
Absolutely. Boundaries are crucial, especially when dealing with challenging behaviors.
Okay, so how do you do that without shutting them down?
It's about being clear and assertive, but also respectful. You might say, I understand you're upset, but it's not okay to yell at me.
Right, so you're acknowledging their feelings, but also setting a clear expectation for acceptable behavior.
Exactly. And if the situation escalates, don't hesitate to call for backup.
Right, sometimes you need reinforcements. Now, we've talked a lot about the nurse's role, but what about the patient? What are some signs that they're starting to engage and benefit from the process?
One of the most obvious signs is increased openness. They're more willing to share their thoughts and feelings.
So they're starting to trust you to let you into their world.
Exactly. They might also start asking more questions, showing a genuine interest in understanding their condition and treatment options.
So they're becoming active participants in their own recovery.
Precisely. And that's a huge step. Another positive sign is a willingness to try new coping strategies.
Oh, so they're putting those tools into practice.
Exactly. Even if it feels a bit awkward or uncomfortable at first. And over time, you might see improvements in their mood, their sleep, their ability to manage stress.
It's like watching a flower bloom in slow motion.
It is those small victories that add up to real progress.
But I imagine there are also challenges, setbacks, times when it feels like you're taking two steps back for every one step forward.
Mm.
What are some of the roadblocks that nurses might encounter?
One of the biggest challenges is dealing with resistance.
Resistance to treatment.
Exactly. Some patients might be reluctant to open up to engage in therapy or to make changes in their lives.
I can understand that change is hard for anyone, but especially when you're battling a mental illness.
Right. So patience is key.
Yeah.
You have to meet the patient where they are, understand their hesitation, and avoid pushing them too hard.
So it's about nurturing that seed of change, allowing it to grow at its own pace.
Exactly. And sometimes you have to get creative. Maybe traditional talk therapy isn't their thing. Maybe they respond better to art therapy or music therapy or even spending time in nature.
So it's about finding what resonates with each individual.
Precisely. What sparks their interest and their willingness to engage?
And what about working with patients from different cultural backgrounds? How do you ensure you're providing culturally sensitive care?
That's a crucial consideration. It starts with recognizing your own cultural biases and assumptions.
So doing your homework, educating yourself about different cultures and being respectful of those differences.
Exactly. And it's always okay to ask questions to clarify something you don't understand or to simply ask the patient about their preferences.
Right. Asking instead of assuming. Now, this whole process sounds incredibly demanding. How do nurses take care of themselves while navigating all these complex relationships and emotional challenges? Is self-care even possible in such a demanding field?
Self-care isn't just possible, it's essential. You can't pour from an empty cup.
So true. So what are some practical tips for avoiding burnout?
Setting boundaries is crucial both at work and in your personal life.
Okay, so learning to say no and to prioritize your own needs.
Exactly. And it's vital to have a strong support system.
Hmm.
Colleagues, you can talk to friends and family who understand the demands of your job, maybe even a therapist.
So you're not alone in this.
Definitely not. And don't forget about those healthy coping mechanisms. Exercise, meditation, hobbies, anything that helps you recharge.
And it's okay to ask for help when you need it.
Absolutely. You don't have to go through this alone.
Well said. You know, it's amazing how this all ties back to human connection.
It does.
Whether it's the connection between nurse and patient, or the support we receive from our colleagues and loved ones.
It's all connected.
And at the end of the day, it's about recognizing that shared humanity and using those connections to foster healing growth and hope.
I couldn't agree more.
It's like we're helping them rewrite their own stories.
Exactly, and that's where the real magic happens.
But I imagine it's not always easy.
It's definitely not. There are going to be times when you feel stuck or frustrated, like you're not making any progress.
So what do you do when you hit those roadblocks?
Well, first of all, it's important to remember that you're not alone.
Right. Reach out to your colleagues, your supervisor, your mentor.
Exactly. Talk it through. Process those feelings. Don't try to carry the weight of the world on your shoulders.
Because that's a recipe for burnout.
Exactly. And sometimes it's helpful to reframe the situation.
Reframe how so?
Well, instead of focusing on the setbacks, try to celebrate the small victories.
Oh, I like that. Focusing on the positive.
Exactly. Even a tiny step forward is still progress. And it's important to acknowledge that.
Because those small wins can add up to big changes over time.
You got it.
Uh,
And it's also crucial to remember that you're not responsible for the patient's choices.
right. We can guide them, we can support them, but ultimately it's up to them to decide what path they want to take.
Exactly. We can't force them to change. We can only create the conditions for change to happen.
And that's where those therapeutic relationships come in.
Absolutely. When patients feel safe and trusted, they're more likely to open up to explore new possibilities, to take those risks that are necessary for growth.
It's like you're creating a fertile ground for healing.
I love that analogy. It's about planting those seeds and nurturing them with compassion and understanding.
You know, as we wrap up this deep dive into therapeutic relationships, I keep coming back to that idea of connection.
Me too. It really is at the heart of everything we do.
Whether it's the connection we build with our patients or the connections we have with our colleagues and support systems.
It's those connections that sustain us, that give us the strength to keep going, even when things get tough.
Absolutely. And to all you future nurses out there,
Yeah.
embrace those connections, cherish those relationships, because they're the foundation of everything we do in this incredible field.
Couldn't have said it better myself.
And that's a wrap on another deep dive into the world of nursing. We'll see you next time for more insights and inspiration. Until then, take care and keep those connections strong.
See you next time.